Wake up in the morning, and before you even think about breakfast, coffee, or checking your phone, there is one thing you want immediately: a glass of water. Your mouth feels dry, your tongue feels rough or sticky, and swallowing may feel uncomfortable. For many people, especially after 50, this has become such a familiar part of the morning that they barely give it a second thought. They simply drink some water and move on. But what if this keeps happening? What if waking up with a dry mouth every morning is your body trying to get your attention? Now, there is no reason to panic. An occasional dry mouth can happen to anyone. You may have slept in a warm room, breathed through your mouth, eaten something salty the night before, or simply gone several hours without drinking. But when the same symptom appears again and again, it becomes worth asking a simple question: why? The interesting part is that the answer may not be as obvious as you think. Sometimes the problem is related to the way you breathe while sleeping. Sometimes it may be connected to your hydration habits, the environment in your bedroom, or even medications you take every day. In other situations, dry mouth may appear alongside other changes that are worth discussing with a healthcare professional. And here is something many people do not realize. Saliva does much more than simply keep your mouth feeling comfortable. It plays an important role in helping you eat, speak, swallow, and protect your teeth and oral tissues. So when your mouth repeatedly feels unusually dry, it may be helpful to pay attention rather than automatically dismissing it as another normal part of getting older. The good news is that understanding the possible causes can give you something valuable: clarity. By the end of this video, you will know what common causes to look for, which warning signs should not be ignored, and what practical steps may help. And the first thing we need to understand is something surprisingly important: why your body produces saliva in the first place. Section 2. Why saliva matters more than you think. Before we can understand why your mouth feels so dry when you wake up, it helps to understand what saliva is actually doing for you while you go about your day and sleep through the night. Most people rarely think about saliva unless they suddenly do not have enough of it. But this simple fluid is much more important than it seems. Think of saliva as your mouth's built-in maintenance crew, working quietly in the background to keep things moving comfortably. It moistens your mouth, helps you chew food, makes swallowing easier, and allows you to speak without that uncomfortable sticky feeling. It also helps wash away tiny food particles and supports the natural protective environment inside your mouth. When enough saliva is present, you usually never notice it because everything simply works as it should. But when saliva production is reduced, or when your mouth becomes dry for other reasons, you begin to notice almost every movement. Your tongue may feel rough. Your lips may feel dry. Certain foods may suddenly feel harder to chew and swallow. Even speaking for a long time can become uncomfortable. This is why persistent dry mouth is more than a minor inconvenience. It can change how comfortable your mouth feels and may affect the natural systems that help protect your teeth and oral tissues. The surprising part is that your mouth does not always become dry simply because there is a problem inside your mouth. Sometimes the cause begins somewhere else entirely. The way you breathe at night, the medications you take, how much fluid your body needs, your sleeping environment, and certain health changes can all play a role. That is why simply taking a sip of water may provide temporary relief without answering the bigger question. And this brings us to another common assumption, especially after age 50. Many people believe that dry mouth is simply something they must accept as they get older. But while aging can coincide with changes that make dry mouth more common, age itself is not always the complete explanation. Section 3. Is it really just aging? One of the most common things I hear people say is, "I'm getting older, so I guess this is normal." And while getting older does bring changes to the body, that explanation can sometimes become a little too convenient. It may cause people to stop asking questions about symptoms that deserve a closer look. Dry mouth is a good example. Yes, many adults notice it more often as they get older, but that does not necessarily mean age itself is the direct cause. Think about everything else that often changes with age. Many people begin taking additional medications. Sleep patterns may change. Some people become less active, while others may not notice thirst as strongly as they once did. Dental changes, breathing patterns, and certain health conditions can also become more common. So when someone says, "It's just aging," they may be overlooking the actual factors contributing to the problem. Here is the encouraging part. Identifying a possible cause can sometimes give you options. Perhaps your bedroom air is unusually dry. Maybe you are breathing through your mouth at night because of congestion. Maybe a medication is contributing to the symptom. Or perhaps there are other signs happening at the same time that should be discussed with a healthcare professional. The goal is not to become worried about every small change in your body. The goal is to become more observant. Your body often gives you information through patterns. If something happens once, it may mean very little. But if it happens night after night, that pattern is worth noticing. And one of the most overlooked patterns behind morning dry mouth may be happening for several hours every night while you are completely asleep and unaware of it, the way you are breathing. Section 4. You may be sleeping with your mouth open. Imagine going to bed feeling completely normal. Your mouth feels comfortable, you are not especially thirsty, and nothing seems unusual. Then, 8 hours later, you wake up with a mouth that feels dry, sticky, and uncomfortable. What happened during those hours? For many people, one possible answer is simple. They may have been breathing through their mouth while sleeping. Your nose is designed to be the main pathway for breathing, helping condition the air before it reaches deeper into your respiratory system. But when the nose is blocked or breathing becomes difficult, the body may naturally rely more on the mouth. Over several hours, constant airflow through the mouth can contribute to dryness. You may not even realize it is happening. Nasal congestion from allergies, a cold, or other causes can make mouth breathing more likely. Sleeping position may also play a role. Some people notice that their dry mouth seems worse on mornings after a night of loud snoring. This does not mean that everyone with dry mouth has a serious sleep problem, and it is important not to diagnose yourself based on one symptom. But persistent snoring, frequent waking, gasping, or other signs of disrupted breathing are worth discussing with a healthcare professional. The key is to look for patterns rather than jumping to conclusions. Ask yourself, is my dry mouth worse when my nose feels blocked? Do I wake up with my mouth open? Does my partner mention snoring? Do I feel unusually tired despite spending enough time in bed? Sometimes the clue is not something you notice after waking. Sometimes the clue is hidden inside your sleep. And while nighttime breathing is one possible explanation, another very common cause may be much closer than you think. For many adults over 50, the next clue may be sitting quietly inside the medicine cabinet. Section 5. Could your medication be causing it? Many people are surprised to learn that dry mouth can sometimes be related to medications. This becomes especially important as we get older, because many adults take more than one medication each day. A person may notice that their mouth has become drier and automatically blame dehydration or aging, without realizing that a medication change could be contributing. Different types of medicines can affect the body's natural saliva production or leave the mouth feeling drier. That does not mean your medication is necessarily the cause, and it certainly does not mean you should stop taking anything on your own. This is extremely important. Never stop, skip, or change a prescribed medication simply because you suspect it may be causing dry mouth. Instead, pay attention to the timing. Did the dryness begin after starting a new medication? Did it become worse after a dose was changed? Are you taking several medicines that may be affecting you at the same time? These are useful questions to discuss with your doctor or pharmacist. Sometimes a patient spends months trying different mouth rinses or drinking more water, only to discover during a medication review that the timing of the symptom provides an important clue. That conversation does not always mean the medication needs to be stopped. A healthcare professional may have other ways to help manage the symptom while protecting the reason you need the medication in the first place. This is where paying attention can be empowering. You are not trying to diagnose yourself. You are gathering useful information. And now we come to another mistake many people make. They assume that if dry mouth means dehydration, drinking more and more water must automatically solve the problem. But the truth is a little more complicated. Section 6. Are you actually dehydrated? Dehydration can certainly contribute to a dry mouth, but it is important not to assume that every dry mouth problem has the same cause. Think about a typical day. Perhaps you start with coffee, stay busy for hours, eat your meals, and suddenly realize by evening that you have barely had anything to drink. Then you go to bed and spend the entire night without fluids. By morning, your body and mouth may understandably feel dry. But hydration needs are not identical for everyone. There is no single amount of water that automatically works perfectly for every person. Age, body size, activity level, climate, diet, medications, and certain health conditions can all influence fluid needs. Some people may also have medical reasons to follow specific fluid recommendations from their healthcare professional. That is why simply forcing yourself to drink excessive amounts of water is not necessarily the answer. Instead, think about your overall hydration pattern. Are you regularly drinking appropriate fluids throughout the day, or are you trying to catch up all at once in the evening? Is your bedroom especially warm or dry? Have you been sweating more than usual, exercising, or dealing with an illness? These details can matter, but here is where things become interesting. If you are drinking regularly and still waking up with persistent dry mouth, especially if you are also unusually thirsty during the day or experiencing other changes, then it may be time to look beyond your water glass. A dry mouth is a symptom, not a diagnosis. And sometimes the most useful clue comes from noticing what other symptoms are appearing beside it. Section 7. When dry mouth comes with other symptoms. One of the biggest mistakes people make with health symptoms is looking at each one separately. A dry mouth here. A little fatigue there. More trips to the bathroom. Increased thirst. Each change may seem small on its own, but sometimes the pattern matters more than any single symptom. This does not mean you should panic every time two symptoms appear together. It means you should become a careful observer of your own body. For example, if you wake up with a dry mouth once after sleeping in a warm room, that may not mean much. But if you repeatedly wake up with dry mouth and also notice unusual thirst throughout the day, frequent urination, persistent fatigue, or other ongoing changes, those details are worth discussing with a healthcare professional. Some metabolic conditions, including problems involving blood sugar regulation, can affect the body's fluid balance and contribute to increased thirst and dryness. But dry mouth alone does not mean you have diabetes, and it should never be used to diagnose yourself. The important lesson is to look at the bigger picture. Your healthcare professional can consider your symptoms, medical history, medications, and appropriate tests if necessary. Think of it like putting together pieces of a puzzle. One piece rarely shows the whole picture, but several connected pieces may reveal something more useful. And there is another important point many people overlook. Sometimes the dry feeling is not only related to what is happening elsewhere in the body. Sometimes the mouth itself has been dealing with reduced moisture for long enough that oral health and daily comfort begin to suffer. Section 8. The hidden connection between dry mouth and oral health. When people think about dry mouth, they usually think about thirst. They imagine reaching for a glass of water and solving the problem. But your mouth depends on moisture for much more than satisfying thirst. Saliva helps create a comfortable environment for eating, speaking, swallowing, and protecting the tissues inside your mouth. When that moisture is repeatedly reduced, everyday activities can become surprisingly uncomfortable. You may notice that dry foods are harder to chew or swallow. Your mouth may feel sticky. Your tongue may feel rough. Some people even find that talking for long periods becomes uncomfortable. Persistent dryness can also affect the mouth's natural protective environment, which is one reason it is useful to mention ongoing dry mouth during regular dental visits. A dentist may be interested in changes that you have simply learned to tolerate. Imagine someone who visits the dentist because of repeated discomfort but never mentions that they wake up with a very dry mouth every morning. That missing detail could be important when looking at the complete picture. Another common mistake is focusing only on temporary relief. Mouth products may provide comfort, but symptom relief and identifying the underlying cause are not always the same thing. If the problem is related to mouth breathing, medication, hydration, or another health issue, simply masking the dryness may not answer the bigger question. This is why persistent dry mouth deserves attention without fear. It is not about assuming the worst. It is about understanding your body's pattern. And that naturally leads to an important question. How do you know when dry mouth is a minor inconvenience and when it is time to stop ignoring it? Section 9. Warning signs you should not ignore. The most important thing to remember is that dry mouth by itself does not automatically mean something serious. But persistent symptoms deserve more attention than occasional ones. If you wake up with a dry mouth once in a while, there may be a simple explanation. However, if the dryness continues for weeks, repeatedly disrupts your comfort, or begins affecting eating, swallowing, or speaking, it is worth mentioning to a healthcare professional or dentist. Pay attention if you are waking frequently because of intense thirst, if your mouth feels persistently uncomfortable throughout the day, or if other changes are appearing at the same time. New or worsening symptoms after starting or changing medication are also worth discussing. Persistent, loud snoring, waking, suddenly gasping, or feeling unusually tired despite adequate time in bed may deserve medical attention as well. Again, these signs do not automatically tell you what the cause is. They simply tell you that ignoring the pattern may not be the best choice. One helpful approach is to write down what you notice for several days. When is the dryness worst? Does it happen only in the morning? Are you congested at night? Have you started any new medications? Are you waking frequently? Do you notice unusual thirst during the day? This information can make conversations with healthcare professionals much more useful. Before assuming the worst, though, there are several simple mistakes that can make morning dry mouth worse, and some of them may be easier to change than you expect. Section 10, 7 common mistakes that can make morning dry mouth worse. Sometimes the cause of morning dry mouth is not one major problem, but several small habits working together. The first mistake is ignoring ongoing nasal congestion. If you cannot comfortably breathe through your nose, you may be more likely to breathe through your mouth during sleep. The second mistake is assuming every dry mouth problem can be solved by drinking more water. Hydration matters, but it is not the answer to every cause. The third mistake is never reviewing medication changes. If the timing of your symptoms changed after starting or adjusting a medicine, that is useful information to share with your doctor or pharmacist. The fourth mistake is overlooking your sleeping environment. A very warm or dry bedroom may contribute to discomfort during the night. The fifth mistake is consuming things before bed that leave your mouth feeling dry or irritated, and then assuming the morning symptom appeared for no reason. The sixth mistake is ignoring, snoring, or consistently poor sleep. While these issues do not always have the same cause, persistent sleep-related symptoms deserve attention. And the seventh mistake may be the most common of all, deciding that dry mouth is simply normal because you are getting older. This is not about becoming afraid of every symptom. It is about giving yourself the chance to understand what is happening. Small changes in habits can sometimes improve comfort, while persistent symptoms can be discussed before they become easier to ignore. So rather than feeling overwhelmed by all the possible causes, let us turn this information into something practical, a simple routine you can begin thinking about tonight. Section 11, a simple nighttime routine for a healthier mouth. The goal is not to create a complicated bedtime routine filled with dozens of products or rules. Instead, start by paying attention to a few simple patterns. Throughout the day, make sure you are following appropriate hydration habits for your individual needs, especially if your healthcare professional has given you specific guidance. Notice whether you tend to go for long periods without drinking and then try to catch up late at night. Before bed, think about how well you are breathing through your nose. If ongoing congestion is making nasal breathing difficult, consider discussing appropriate options with a healthcare professional. Pay attention to your bedroom environment as well. If the air consistently feels extremely dry or uncomfortable, that may be worth considering as part of the overall picture. Good oral hygiene remains important, especially when dryness is persistent. And if you take medications regularly, do not change them yourself, but make a note of when symptoms began and discuss possible side effects with your doctor or pharmacist. You can also keep a simple record for several nights. Notice when the dryness occurs, how severe it feels, whether you snore, whether you wake during the night, and whether other symptoms appear. This kind of observation can turn a vague complaint into useful information. Imagine waking up a week from now not simply wondering, "Why is my mouth dry again?" but having a clearer picture of what may be contributing. Before we finish, though, there are a few stubborn myths that can cause people to ignore an important pattern for far too long. Section 12, 3 dangerous myths about dry mouth. The first myth is that dry mouth always means dehydration. While dehydration can certainly contribute, persistent dryness can also be related to breathing patterns, medications, the sleep environment, oral health, or other health changes. The second myth is that dry mouth is simply an unavoidable part of getting older. Aging may coincide with factors that make dryness more common, but that does not mean every persistent symptom should be accepted without question. The third myth is that if you can tolerate the problem, you do not need to mention it. Many people quietly adjust. They keep water beside the bed, avoid certain foods, or simply accept the discomfort. But healthcare professionals and dental professionals can only consider the symptoms you actually tell them about. A persistent dry mouth may be a useful clue when combined with your medications, sleep patterns, medical history, and other symptoms. The important message is simple. Do not ignore the signal, but do not panic about the signal either. Notice it. Track it. Put it into context. Ask questions when the pattern continues. That approach is far more useful than either extreme of dismissing every symptom or assuming every symptom means something serious. And if you remember only one lesson from this entire video, it should be this. Section 13, the one thing your morning dry mouth may be telling you. Your morning dry mouth is not giving you a diagnosis. It is giving you information. That distinction matters. An occasional dry mouth may simply reflect a warm room, temporary congestion, or a long night without drinking. But when the same symptom becomes persistent, it may be your body's way of encouraging you to look more closely at the bigger picture. Consider your sleep. Are you breathing through your mouth? Do you snore? Think about hydration. Are you drinking appropriately throughout the day? Consider your medications and whether the timing of your symptoms changed after a new prescription or dose adjustment. Think about your oral health and whether dryness is affecting your comfort, eating, or speaking. Finally, notice whether other symptoms are appearing alongside it. Small clues can become useful when you connect them. The goal is not fear, it is awareness. Instead of asking, "What terrible thing does this mean?" ask, "What pattern is my body showing me?" That simple change in thinking can help you make better decisions and know when a conversation with a healthcare professional may be helpful. And with that in mind, let us bring everything together into one quick, practical recap. Section 14. Quick recap. What to check tonight. If you regularly wake up with a dry mouth, start by noticing whether it is occasional or persistent. Think about how you breathe during sleep and whether nasal congestion, mouth breathing, or snoring may be contributing. Consider your overall hydration habits rather than assuming that more water always solves every problem. Pay attention to medication changes, but never stop prescribed medication without professional guidance. Notice whether other symptoms are appearing, especially persistent thirst, frequent urination, unusual fatigue, or significant sleep problems. Mention ongoing dry mouth to your dentist or healthcare professional so they can consider it as part of your complete health picture. Most importantly, avoid trying to diagnose yourself from one symptom alone. Your body often communicates through patterns, and understanding those patterns can be far more helpful than ignoring them. Sometimes the first sign of a change is not dramatic. Sometimes it is simply waking up and immediately feeling that you need a glass of water. Section 15. Strong ending and natural CTA. So tomorrow morning, if you wake up with a dry mouth, you do not need to panic. But you also do not have to automatically dismiss it. Pause for a moment and think about the pattern. Has this happened once, or has it been happening every day? Have you noticed changes in your breathing, sleep, medications, hydration, or overall health? The answers may not always be obvious, but asking the right questions is often the first step toward understanding what your body is telling you. Persistent symptoms are worth discussing with the appropriate healthcare professional, especially when they begin affecting your comfort or appear alongside other changes. The good news is that paying attention gives you more control, not less. Your body does not always communicate through dramatic symptoms. Sometimes it starts with something small, familiar, and easy to ignore. If you have experienced morning dry mouth, share how often it happens to you in the comments. And if you enjoy clear, practical information that helps you understand your health as you get older, subscribe for more videos like this. Because staying healthy is not about being afraid of every change. It is about noticing what matters, asking better questions, and taking practical steps when you can. Your body may not always shout when something changes. Sometimes it whispers. The smartest thing you can do is learn to listen.